Thank you so much, Yusra, for such a comprehensive introduction. And I'm very grateful to ICI for having me over for such an important session, I would say. Being a clinician and a researcher, I realize that it's very, very important for clinicians to be researchers as well. And clinical research is a specialty which I know we all are not very sort of versed about it. And most of the times, as you all remember, if most of you are medical professionals over here, so during our undergraduate years, when we used to have research sessions in our medical college in community medicine, most of us used to actually bunk it. And unfortunately, I was one of those people bunking it as well. And now I'm here after doing my master's in clinical research and a PhD. I realized how important was it at this point, at that point in time as well, to actually understand research and why is it important. How do you go about it if you're a beginner, if you want to do your own research for so many purposes it may be for, but how should you start? That is what we are going to discuss today. What is a manuscript? How do you go about writing a manuscript? What are the first few steps before you start writing a manuscript? So we're going to discuss everything in detail. I would want that if I ask you any questions, if there are any MCQs or best choice questions I show you, if you can just answer those questions in your Q&A, sort of boxes. So I would have those answers with me, and we are going to be able to interact, because I know it's not easy to, stay alert for an hour. So it would be good if you all can interact with me. And I know, because being a teacher and educationist, I realize the importance of having students, face to face, having eye contact with you, with all of you, and knowing, how many of you are actually understanding from your gestures. So it's sort of a bit strange for me, sitting online and not being able to see my participants. But that's how we're managing education for the last 2 years, and now all of us are sort of on the same platform and on the same frequency, and we understand each other. Teacher understands her online students, and the online students have now started understanding their online facilitators as well. So can I please share my slide, and we're going to just start. I hope all of you can see the slides. And yes, so okay. So the objectives of my presentation, my session today would be that by the end of this session, the participants will be able to know the tools needed to initiate clinical research and a basic outline of a clinical research protocol. So this is where we start learning, and this is where research arises from. So the more I learn, the more I realize how much I don't know. So whenever this thought comes into your mind while doing your clinics, while doing your practice, if you're a lab technician, if you're a nurse, if you're a physiotherapist, or any medical and allied field you belong to, whatever you're working, whatever you're practicing, a lot of times you come up with questions you don't have answers to. And of course, we all do not have answers to all the questions in the world, right? So whenever a question like this comes to our mind, how do we go about it? How do we start searching for it? What is available already? What do we already know about that question, and what is not known? So the question is sort of left unanswered if there is a lot to know more, and if a lot of things are unknown already. So why do we need to do research? Why do we need to publish research? We might have to say something important. We may want to share what we are doing for maybe the community, the population, for a specific group of people. We may want to change practice because we understand that the practices we are doing in our part of the world may be sort of better in the local context, or it may be generalizable to other populations and other communities as well, to promote a thought or a debate. So, it may be sort of a philosophical thing which you need to push and come up with a hypothesis as a thought process, what needs to be done in the future. Well, you may want to educate people. You may have a lot of knowledge yourself already, and you may want to give it off to other people. And that is why you want to publish your research. You may want to get into a high impact journal. You may want to increase your H index, or you may want to sort of be a researcher, be sort of known as a researcher. You may want to advance your career. As you know, that in most of the medicine and allied fields these days, you need promotions, and for promotions you need researchers, you need publications in international as well as national impact factor journals. So what are those impact factor journals? Why do you need to, how do you get into it? So these are all the things which are questions which are unanswered for most of the medicine and allied people. Keeping your job, it may be a requirement of your job. If you don't publish, then you don't get promoted. If you don't get promoted, of course you lose your job eventually. And some people might be using it to make money, because you can also get grants, huge grants, research grants, and you can be sort of the principal investigator who gets paid for doing that research. So you want to make money as well. So these are all the reasons why you would want to do your own research, publish your own manuscript. So how do you begin, working on it? How do you start it? So first of all, you need to design a protocol. And what is a protocol? Protocol is a plan of the study. So whatever research you want to do, whatever question is in your mind, you need to sort of design a plan as to how are you going to go about it. So you need to design a protocol, because all great creative work is built on a strong foundation. So a plan is the foundation of your research. Whatever starts in your mind has to have a plan to sort of make it into action, right? So you think of a broad research topic. For example, you're practicing clinician. I'm a general practitioner. I'm a trained family physician. So, while practicing, it comes into my mind that a lot of women I am seeing these days with anemia, with pallor, they usually are chewing tobacco or betel nuts or erica nuts, what you call, jisko supari kehte hain na. So a lot of times I see that women who are anemic are chewing betel nuts, and from there it comes into my mind, does betel nut lead to anemia? And when I, for example, search it, I don't find a lot of researches on it. I don't find a lot of publications on it, and it is not even mentioned as a risk factor for anemia among the diet which are responsible for having anemia. For example, a low iron deficiency, or in iron deficiency, a low iron diet would actually lead to anemia. That's what we already know. But what we don't know is if anything interferes with the iron absorption, and if betel nut is specifically notorious. So that's what comes into my mind. So what I do, I search literature. I look for evidence, right? I open up Google, I open up Google Scholar, and I look for it, what is already known. And if I find a lot of papers already mentioning betel nut or erica nut as a risk factor for anemia, that's fine. I know what's causing anemia in this patient. But if I don't find a lot of researches, then it comes into my mind that why don't I do my own research? Why don't I look for the answer myself, and look if actually erica nut chewing or betel nut chewing is associated with anemia among the patients coming to me. So I write the objectives of my research to know the association of betel nut chewing with anemia among a Pakistani population. So I come up with the objectives. I design a research protocol in terms of I come up with the methodology. How am I going to do it? Where do I get my participants from? So we're going to discuss the different components of methodology later on. And finally, when my protocol is ready, I submit it to an ethical committee for approval. It could be an IRC, which is an institutional review committee, an institutional review board, or an ethical committee, whatever exists in your institution. If you're doing it in the community, in the population, then you might need permission from maybe the head of union council, or somebody who's supervising or managing the community. So you need approval from the appropriate people. Then you start collecting data. Then you analyze and interpret results when you have completed your data collection. Then you come up with a manuscript. So you write all these components in the manuscript: an introduction, the results, the methodology, and a discussion and a conclusion. So you come up with a manuscript. Finally, you submit it for publication to a journal, or if it's a thesis, you can write a thesis out of it. If it's a dissertation, which most of the postgraduate trainees in Pakistan who are sort of clinicians and doing their post-graduation in any subject, they need a dissertation as a mandatory requirement to take their Part 2 exam. So you need to submit that, right? So the first step of beginning to start your own research independently, of writing a protocol, is coming up with a research question, as we just came up with it while seeing patients. So what should I write about is the biggest question, I would say. If you know what to write about, you can write about it. You can know the tools. You can sort of search literature. You can find out the methodology. But the first question is what to write about and how important it is. If that question is ethical, can you actually do that study? Or it can harm a few of your patients? Could that study harm your patients? It has to be very specific, so you have to answer one specific questions. For example, you cannot ask a very broad or vague question like, what causes anemia? We already know that. This is something which is already known. It's in the books, it's in the literature. But a specific question, for example, as I told you, does a betel nut chewing cause anemia? It has to be novel. It has to be something which has not been done before, or maybe not been done in the local context. So a lot of studies are done in internationally in different parts of the world, but you may want to look it up in the local context. For example, Naswar, or for that reason, gutka. So in how many sort of countries of the world is gutka taken? So you may not find a lot of researches on gutka chewing, what are the hazardous effects of gutka chewing, because it's not taken in most parts of the world, and it is very specific to South Asian countries. So it may be a novel question because nobody has done it before. It should be answerable. So you should have a specific outcome you're looking for. What are you looking for, right? It has to be relevant to your local practice, to whatever field you are in, to whatever practice you're doing, and it has to be feasible and cost effective. It need not be over ambitious and something which you will not be able to gather money for, grants for, and if you're a beginner, then you cannot get huge grants. So it has to be feasible. You should be able to do it. So initially, if you begin with questionnaire-based studies or looking at associations or frequencies and prevalences would actually serve the purpose, and you're going to understand how to begin research. And then you can move on to randomized controlled trials and other study designs, which we're going to talk about. Step 2, as I said, is searching literature. So trying to find out if this question has been answered before, and where and when has it been answered. From there, you rationalize your study. For example, this has never been done before, or it has never been studied in the local context. So I want to do this study. And from there, you write an introduction of the research topic. And how do you write an introduction of the research topic? You write the background of the topic. For example, how much, if I talk about the same question as I was I just mentioned. So for this question, you need to write about anemia. How common is anemia around the globe? How common is anemia in Pakistan? What are the risk factors which have already been studied in the past, and we know that these are associated with anemia? What has not been done before? So available literature, international, local, gaps in the literature. So what has not been done before? What is a question which has not been answered before. From there, your rationale of the study comes, why you are doing the study. And you write finally your objectives. And from the objectives, your title comes, right? So writing objectives and title. So how do you come up with an objective? There can be primary objectives and there can be secondary objectives. So for the same study, the primary objective would be to determine the frequency of anemia among women coming to a primary care clinic in Pakistan, or to determine the frequency of anemia among a community in Karachi, Pakistan, right? So it depends where you're taking your sample from. The secondary objective would be to determine the association of betel nut chewing with anemia among women, right? So this could be a secondary objective. For example, this is another study to determine frequency of neuropathy among newly diagnosed diabetic patients in South Asia, right? So this can be the primary objective. You're trying to find out how many patients who are recently diagnosed to have diabetes have actually neuropathy at presentation, right? What could be the secondary objective? To assess the risk factors associated with neuropathy among newly diagnosed diabetic patients in South Asia. So you're now assessing the risk factors and the frequency as well, and you have a primary objective, you have a secondary objective. So what could be the title of this specific study? So what could be the title of this specific study? It should reflect the objectives of the study, and it is written after the whole protocol. It is a true representative of the plan. So for the same study for which I mentioned the objectives, what could be a good title for the study? Think about it. Let's say you could choose from one of these titles: diabetic neuropathy among newly diagnosed diabetics in South Asia. It could be frequency and risk factors of diabetic neuropathy among newly diagnosed diabetics in South Asia. Diabetic neuropathy among newly diagnosed diabetics, frequency and risk factors. So you can write the same thing in different ways, whatever looks appealing to you, whatever title is a bit catchy, you think that it actually represents what you're trying to do. So all these titles are correct, and one of these you could choose for your own study. So then you plan a methodology for your study. You come up with operational definitions, a study design. Where are you going to do the study, as in the setting and the study duration? How long would the study last? What would be the inclusion and exclusion criteria for participants? How would you calculate the sample size? What are the ethics or ethical considerations you need to keep in mind, as in you need a consent of the patient? What would be the sampling technique? How would you pick up patients for your study? How would you pick up participants? What would be data collection tools? Would you want to use a questionnaire-based study? Would you want to do a hemoglobin levels on everybody? Would it be online? Would it be a self-administered questionnaire, or would a doctor fill it up? Who would fill it up? And how would you analyze the data? So this is the complete methodology plan for a research you're planning. Coming to operational definitions. It is the definition of the exposure and outcome variables of interest and their means of measurement. So for example, let's say for the same study as we just discussed, which of the following operational definition do you think is okay? If you can just write it in your chat boxes or in your Q&A boxes, if you can just mark which of these would be a better operational definition for diabetes in this particular study. As I already mentioned, the frequency of neuropathy among newly diagnosed diabetic patients. So A is fasting blood sugar more than 125 or HbA1c more than 6.5 among those screened with no prior history of diabetes and not on oral hypoglycemic. Fasting sugar more than 125 or HbA1c more than 6.5. Diabetes is a chronic disease that occurs when the pancreas is no longer able to make insulin and when the body cannot make good use of insulin products. So I see that a few people are answering it, and Dr. Ghazala just answered A. Yes, absolutely right, Ghazala, because why A? Yes, absolutely. I see that people are picking up, So operational definitions are definitions which you use for your own study, right? So how are you going to label somebody to have diabetes? And what is newly diagnosed diabetes? So you want newly diagnosed diabetes in your diabetics in your patient, in your participants. So with no prior history of diabetes and not on oral hypoglycemic. So that is the correct answer. Absolutely. Right. So what about neuropathy? If somebody else wants to try this, neuropathy is damage or dysfunction of one or more nerves that typically results in numbness, tingling, muscle weakness, and pain, or unilateral or bilateral reduced vibration, proprioception in big toe to touch and checked on feet, right, with a monofilament. So which of these do you think is a better operational definition for neuropathy for the same study, frequency and associated risk factors of neuropathy among newly diagnosed diabetic patients? Which of these do you think? So Dr. Urusa has answered as A. Okay. Any other one option? These are two options, Urusa, A and B. So which one are you choosing? Which one do you think is a good operational definition of neuropathy for the study? What do you all think? Okay, yes. Okay, so Urusa says A and Ghazala is saying B. Dr. Zaman says B. Absolutely. So you see, how would you measure it is what is important. When you're writing your operational definition, Urusa, you need to know how would you measure it. You need not write a dictionary definition or a definition which is taken from Google, but how would you do it in terms of when you are actually picking up patients who have neuropathy and who do not have neuropathy, how would you do it in practically, as in practically. So B is the correct answer because it actually tells you how are you going to measure it. So let's come to study design. So these are just broadly, you can see different study designs which you can use in a clinical research. Either your study design could be observational or it could be experimental. So in observational study design, the researcher just stands back and observes what's going on. In an experimental study design, the researcher intervenes, he does something, as in, he might give a medicine, he might, do a diagnostic test, or, something which he intervenes, not only observes. An observational study, it could be analytic or it could be descriptive, and descriptive studies could either be cross-sectional, it could be case reports, it could be case series. Analytical studies could be cohort and case control, in which you compare two groups. So when you're comparing two groups, that's an analytical study design. And when you're just observing, and then after observing, you might want to compare, you may not want to compare, that's a descriptive study design. So let's see if you can guess, as in, you're not trained in research, but let's make a guess. To determine frequency of neuropathy among newly diagnosed diabetic patients in South Asia, and you can directly write this in your chat boxes, please. Whatever you want to answer, you can write in your chat boxes. Which of the study design is an appropriate study design for this study to determine frequency of neuropathy among newly diagnosed diabetic patients in South Asia? What do you think? So I'm waiting for a few answers. Let's see if you can guess, maybe guess, a lot of times we don't know. Yes, Dr. Arif says C. So he thinks this should be a randomized controlled trial. Well, okay, that's not the right answer though. So you still have more answers to choose from. It's to determine frequency, right? You're just observing, you're just counting. You're just going to the community and you're counting 1, 2, 3, 4. How many patients are having neuropathy among diabetic patients? So Dr. Amin is saying retrospective cohort. Well, that's also not the right answer. So now you're left with 3 answers, You might have taken a 50-50 initially, maybe that would have helped, but now you're still left with 3 answers. So any more guesses? Any more guesses? So this is, let me tell you. Okay, so this is a cross-sectional study, right? A cross-sectional study is like a prevalence study. It's like a survey, and to determine frequency is a survey rather than anything else. So this is a cross-sectional study. What about this one? Neuropathy as a complication of COVID-19, or if we say, for example, Guillain-Barré syndrome after COVID-19. So what do you all think? What type of study design would that be? If you can just write in your chat boxes directly, please. Neuropathy as a complication of COVID-19. So that's like very, very something which was very uncommon. If you look it up in 2020, how common was, how commonly would we see neuropathy as a complication of COVID-19? So that's something which, let's take it as a very, very rare phenomena. So it's a very rare phenomena. If somebody is actually reporting a very rare phenomena, what do you think would be the study design for this study? Neuropathy as a complication of COVID-19. What do you think? Any guesses? I just said it's a very rare phenomena which the researcher is reporting. Okay, so there's a question. Can you please redefine all these options with their scope? So you want me to tell you about study designs. Okay, let me just go back. I'm just going to come back to this. So observational study designs and experimental study designs. And observational could be descriptive or analytic. Descriptive, just, like a survey, cross-sectional case series, case reports, and analytical cohort and case control. So let's come back to the question. Neuropathy as a complication of COVID-19, which is a rare phenomena, is actually a case report, right? This is a case report because it's something which is very, very rare, right? It was hardly being reported when going back in 2020, if you look at it. What about this one? To compare risk factors associated with and without neuropathy among diabetics. So what do you think? What could be an appropriate study design for this? To compare risk factors. So now you're comparing. So as I said, when you're comparing, it is very likely to be an analytical study design. So you're analyzing, you're comparing risk factors among patients with and without neuropathy among diabetics. Can you please take control of the background voice in here? I can hear some background noises, please. Okay, so what do you think should be the answer to this? To compare risk factors associated with and without neuropathy among diabetics. This is comparison. So it could be either a case control study maybe, or a cohort study. So either one of these, because these are observational studies and comparative studies. So the answer is case control study, because it's comparing 2 groups, those with neuropathy and those without neuropathy. So let's look at this one. This is very pertinent to, I would say, pharmaceutical industries as well. Efficacy of duloxetine versus pregabalin among diabetic patients with neuropathy. So this is, you're comparing two drugs, the efficacy of two drugs among patients with neuropathy. So if you look at this possible study designs, case control, cross-sectional, RCT, or a randomized controlled trial, a prospective or a retrospective cohort design, or a case report. So which of the following do you think should be a better study design for this question? So this seems to be like you are experimenting, right? So because it's an experimental study, it is very likely to be a randomized controlled trial, because that may be the best study design for this question. Looking at this question, weight changes among diabetic patients on metformin only versus empagliflozin only among newly diagnosed diabetics. So you're comparing if metformin leads to better weight reduction or empagliflozin leads to better weight reduction among diabetics. And if you're comparing both these medicines, then either it could be a randomized controlled trial, but if we look at it, it might be unethical to deprive one group of metformin, because we already know that metformin is the first line oral hypoglycemic. So you cannot start somebody on empagliflozin and deprive them of the first line medicine, which is metformin. So it might be unethical if you do it as a randomized controlled trial. So the answer to this question is prospective or a retrospective cohort study, right? So these are all the study designs. The purpose of highlighting all this was that if you're sort of preparing yourself to start a research, you need to know about these study designs. And this is a very sort of a vast topic which we need more time to discuss about and to make you understand the different study designs which are possible if you are taking up a research study of your own. Then you need to design what is the setting of the study, where are you going to do the study, and how long will the study take? So for how long, what would be the duration of the study, 6 months to a year, of 2 years? So you need to come up with a timeline. For example, you're going to design the protocol for the next 3 months. Then you're going to apply to IRB, which is the Institutional Review Board. When it gets approved, then you are going to collect data. Your data collection would last for 6 months. And then you're going to start writing results, analyzing the study, writing a manuscript, and finally giving it off for a publication, right? So what is the timeline of the whole research process which you're going to undertake? That's the duration of the study and the timelines. You need to come up with a sample size, which is done through softwares, and it's very easy to use softwares. It's not difficult. Any layperson can use these softwares if you know how to do it. So there's a WHO software and there's an open EPI software, which helps you calculate the sample size. So let's see, again, coming to the same objectives, to determine frequency of neuropathy among newly diagnosed diabetic patients in South Asia. Which is the correct inclusion criteria for this objective? So who are the patients or who are the participants you should be including in your particular study you want to start? So what are the inclusion criteria for the following objective? What do you think? So if you can answer, all diabetic patients visiting OPDs, all patients visiting diabetes clinics, diabetic patients who screen positive for neuropathy in the community, those who screen positive for diabetes with no previous history of diabetes, those who screen positive for diabetes and neuropathy with no previous history of diabetes. So which of the following participants should be included in your study, to which the objective is to determine frequency of neuropathy among newly diagnosed diabetic patients in South Asia? So you need to have a pool of participants from which you would know how many of these participants have neuropathy. so that you would be able to find the prevalence of neuropathy in a particular set of participants. So what would be the inclusion criteria? It would be those who screen positive for diabetes with no previous history of diabetes. So anybody who comes to you who does not report diabetes and now for the first time is newly diagnosed to have diabetes, you're going to assess them if they have neuropathy or if they don't have neuropathy. So for example, out of 100 such newly diagnosed diabetics, 50 are found to have neuropathy, then you can say that the prevalence of neuropathy among newly diagnosed diabetics is 50%, for example, right? So what is the correct exclusion criteria now? Okay, so which patients would you exclude? Of course, you may want to exclude diabetic patients with completely uncontrolled blood sugars, right? So those diabetic patients who are already diabetics and whose blood sugars are already uncontrolled, you may want to exclude them because you know that they would definitely have neuropathy, right? How would you choose your sample is again another sort of a vast topic which you need to understand. Are you going to take every other patient? Are you going to take sort of a random sample, or are you going to take every third patient or every fourth patient? That is systematic sampling. So these are the sampling techniques which you need to know about. Then you need to develop a questionnaire. What variables are you going to add in the questionnaire? For example, the patient's age, the gender, the known comorbids, the medications the patient is on, maybe the family history you would want to include. Maybe you would want to include the weight of the patient, the height of the patient, the BMI of the patient, the diabetes or the sugar control or the first sugar level of the patient and HbA1c. So whatever you want to include in the questionnaire has to be pre-planned and pre-written, and you have to pilot this questionnaire to know if the participants are being able to fill it up, or the doctor who's filling up for the participant understands how to fill the questionnaire. Finally, you need to analyze data, and I wouldn't say that you can do it alone, but you need to take help from a biostatistician in analyzing the data. Only if you understand what your data means, then only your biostatistician will be able to help you with data analysis. If you do not know how and what your data is about and what it means to you, the biostatistician will not be able to help you. It's very important to understand your own data, whatever your data is about. You have to also think about ethical considerations, as in, you should not be harming any patient. You should be careful about privacy and confidentiality of the patients. You should be also careful about taking a consent from the patient, not only a verbal consent, but a written consent. So these days, whenever you send your paper for publication, the manuscript or the journals, they would ask you if you have got it approved from an IRB, as well as if you have taken a written consent from the patients. And if you have not gotten an approval from ERC or IRB, then your paper gets rejected there and then. They don't even send it for peer review. So what are the skills to learn? Of course, you need to learn how to write a methodology for your study. There are a few workshops which you need to attend, an EndNote workshop to reference, right? So when you're writing an introduction, you have to mention where are you taking that literature review from? So which studies are you quoting? And there's a specific way of referencing, and you need to understand, otherwise it just becomes a mess. So if you have 40 references, and if you sort of change anything in your text and those references don't get arranged automatically, you just get into a mess. So you need to have a referencing manager, and EndNote is a reasonable referencing manager which would help you automatically sequence your references and arrange references in your text. Then you need to know a few basic, things about SPSS, which is a software for data entry and analysis. So just very, very basic things. If you know how to enter data, if you know how to analyze data in a very basic way, if you can find out means and percentages and proportions, and if you can find out a chi-square or something like that, that would be great. And of course, as I mentioned, this is how you reference your text, so that is where you need to understand how to reference your manuscript, or how to reference your even protocol, and a referencing manager would help you do that. So this is just a checklist of the research protocol if you want to just take a screenshot or a picture of this and keep this with you. This is going to help you out if you're planning your own research and writing a protocol, So you need to know how to go about each of these headers, and you need to know the basic having a basic understanding of how you pick up sample, what are the inclusion, how do you include or exclude people, how you what is the sampling technique, and of course what are the ethical considerations you should be keeping in mind while you're writing your own research protocol. So these were a few best choice questions, but I see that you're unable to maybe write those answers. So I'm just going to quit these, but I'm going to hand over the presentation so you can look at it. So, protocol writing certificate courses are being offered, and you can attend any of these protocol writing certificate courses and start your research, start planning your research. The courses we would be taking would be 12 online sessions, which would be on weekends. And what we do is that we give regular assignment and feedbacks after each of the session. And at the end of the course, you need to submit a complete research synopsis or a research plan, which is graded and on which you get a feedback, and you can then send that protocol to an institutional review board and get your study going from there, And these also have EndNote and SPSS workshops, and all these workshops are online. So you can attend any of these courses. Dr. Bilal has a question. What is the difference between a research paper and a review paper? That's a very good question, Bilal. So basically, we are talking about original researches. We're talking about manuscripts. When you're talking about manuscripts, when you're talking about original researches, these are clinical researches which you do it yourself independently or in collaboration with other people. So you begin with a scratch, right? You write your own research protocol, you submit it to the IRB, you get an approval, you collect data, you write a manuscript, you submit it to the journal. This is an original research paper. What are reviews? Reviews is, for example, you take a broad topic. For example, you can take complications of diabetes among Pakistani population, and you want to review it. So how do you review it? You take out all the literature which is already available in Pakistan regarding complications of diabetes, and you put all those papers together, and then you come up with a conclusion, that this paper said this paper said that, and what is now your conclusion, that maybe you conclude that the different papers which have been published mention the prevalence of complications among diabetics to be between 20 to 40%, let's say. So this is how you come up with a review. You don't do your own study. You just bring up a lot of papers and make it sort of a cocktail and present it, right? So there's another course which you can take up if you are not a basic researcher. If you have some understanding of writing a research protocol, if you've started your own research, then you can maybe take up the manuscript writing and publication course, and which actually teaches you how to write a manuscript of your own. So you already have data, you've already analyzed data, or you're in the process of analyzing data. So these are for a bit more advanced researchers who've started their own research, but now they want to write their own manuscripts out of the research they have already conducted, right? So this is another course which could be taken up to write papers. So these are all the objectives of the manuscript writing course. And of course, the basic, I would say, the slogan which I carry all the time while teaching people and making people learn: respect, learn, and enjoy what you do. Don't do it just for the sake of it. Do it because you want to make a difference. And even if you make mistakes, it's okay, you know. So you can make mistakes, you can be wrong, you can ask questions, you can say I don't know, and respect each other and still grow and develop. And that's the way, you know, you achieve the best. So if you have any questions, any more questions which have been left unanswered, you can also email me, or Dr. Yusra, over to you if you want, if you have any questions remaining in the Q&A section, so you can let me know.